update on everything that they've been doing. If you guys have not signed up for their newsletter, we're going to make sure that you do that at the end of this meeting today, because they are bomb. Like, they are going out there and they are doing things. So I'm going to go ahead and stop sharing right now. And we're going to go ahead and let our first two presenters go ahead and get started. Miss Christina and Mr. Noah, go ahead and share your screen, and you can just have at it.
Thank you.
Thank you so much. Again, I am Christina Proctor. I am a clinical associate professor at the University of Georgia, and I'm joined in my presentation by Noah Hopkins, who is a PhD student in our program and also a research assistant. And I am very thrilled to be here to share some of the research that we've done in the farming community. We've been doing this work for over 3 years together now, and we're going to focus in on one of our more recent studies that looked at the relationship between, like you mentioned earlier, Carrie, stigma, healthcare challenges, as well as alcohol use in the farming population. So I'm going to let Noah talk a little bit about the background, and then I'll start talking about some of our pre-work before we sent the survey out, and then we'll get into all of the details.
All righty. As Dr. Proctor said, as Ms. Portell said, these three kind of components, stress, formal healthcare challenges, and alcohol, are prominently researched in the farming community and kind of key elements of what we see going on there. So just to briefly cover some background information, beyond the concerns about physical safety and risk of injury that exist in the farming community, farmers consistently identify the high cost of healthcare services as a prominent source of stress for them. This is largely attributable to the fact that many farmers are not afforded insurance through their own, through their employment. They're frequently self-employed. So that high cost of healthcare is a considerable barrier. Other formal healthcare challenges that have been identified as sources of stress amongst farmers are time, time constraints, the time demands of farming, as well as the, frequent long waiting periods to engage with healthcare resources in terms of wait times. This time is particularly significant considering that many farmers live in rural areas where immediate access to healthcare resources is not readily available. So that results in long commutes in both directions, again, taking farmers away from their operations for extended periods, which is a serious challenge for many farmers. In addition to a lack of locally available resources, many farmers have identified poor perceived quality of the resources that may be available to them, right? So there may be a clinic only 30 minutes away, but to handle anything serious, farmers may have to travel an hour or more to engage with a healthcare service, that could handle a critical farm injury or something of that nature, kind of, again, compounding the risks of physical injury inherent in agriculture production. Another substantial and well-documented barrier in the farming community is this kind of lack of cultural competence among healthcare providers. So many farmers report feeling as though doctors and other healthcare providers really don't understand what it is to be a farmer and what the realities of their lifestyle is. And that results in not only poor patient-provider interactions, but decreased willingness to, again, take that time away from their operations to travel and engage with somebody who doesn't have an understanding of what the farmer's lifestyle is and how to deliver quality care that is, compatible with the realities of living on a farm. All of these barriers may lead to farmers ultimately foregoing treatment for physical injuries and other illnesses that can develop into more serious musculoskeletal or chronic health conditions. Farmers have been observed to exhibit higher rates of cancer, chronic respiratory disease, liver disease, as well as some other mental health outcomes like anxiety and depression. And these may ultimately be connected back to farmers foregoing treatment because of these formal healthcare challenges that we've described here. Moving on to kind of focus a little more specifically on mental health, each of those challenges that I just described still exist for mental health care resources. It is rare to have access to mental health care resources in rural areas, but these barriers are also compounded by stigma. So research in the farming community has shown both community and self-stigma associated with the utilization of mental health care resources in the farming community, right? Farmers report feeling as though the self-stigma, I guess, would come from farmers feeling like they are not upholding the values of self-reliance and resilience that are really prioritized in that community, as well as concerns about judgment from other members of the community being seen as crazy or unable to handle the stress of farming if they are seen to be engaging with a mental health care resource, excuse me. So this combination of farming being a high stress occupation, limited access to healthcare resources for either physical or mental health care, and considerable stigma associated with help seeking behavior may place farmers at greater risk for heavy alcohol consumption, which is again going to be kind of the primary focus of the study we're sharing with you today. So I want to turn the mic over to Dr. Proctor.
So a few years ago, I received a seed grant from my university to conduct qualitative research in the farming community. And we set out with the purpose of that research to be to understand stressors, barriers to care, as well as mental health and substance use within the farming population. But another objective of that study was really to better understand how to conduct research with farmers about mental health and substance use. It became very apparent through a research or a literature review that there wasn't a lot of information out there about data collection procedures in regards to mental health and substance use. And there weren't a lot of like farmer-led quantitative studies that were going out. So it was really important to me, as well as some of my other collaborators, that the instrument that we sent out to gauge, these barriers to care, to gauge substance use in the farming population, was guided by farmers. We wanted to make sure that we were using correct terminology, that we were developing a scale that farmers would engage in and understand when they receive that. And so what we did was we traveled to 18 farms and interviewed 32 individuals. And we had representation of both farm owners, farm managers, good representation across commodities, as well as a mix of both male and female farmers who were participating in this qualitative research. And again, the data that we collected from this study really helped us guide the development of the scale that we're going to share with you today. And what we found through this study was that, we identified those top occupational stressors within farming, but we were able to also identify some cultural norms, really hone in on like what barriers to care meant within the farming population, right? Not only are we going to talk about like formal healthcare challenges, but it's also important to think about privacy concerns in rural areas. It's important to think about stigma, both from a self-stigma standpoint as well as a community stigma standpoint. And then we also got a good idea of the coping strategies that our farmers were using to deal with those stressors and those frustrations that they were having within accessing care. So we'll share a little bit about that today as well. No, you can go to the next slide. So again, we wanted to make sure that the survey that we sent out was farmer led, right? So we wanted to make sure that we had farmers test this quantitative instrument, and we wanted to include those constructs that were identified within that qualitative study. So we know, again, from the research that's out there, that we have a good amount of information about stigma, about like healthcare challenges, about resilience within the farming community, but there was really a lack of studies that were looking at the interplay of those contextual factors. So the study that we're going to share today is going to look at alcohol consumption patterns along with some of these other contextual factors that I've talked to you about already. So again, the stigma, the resilience, and the formal healthcare challenges. And we sent out this quantitative instrument to farm workers, farm owners, farm managers, and farm spouses across the United States.
So just to kind of cover the methods that we used here in a little bit more detail, as Dr. Proctor mentioned, this was a cross-sectional survey that we distributed widely across the United States. But before we ever endeavored to send out this survey, we knew that we wanted to, again, pilot it with farmers and other community partners that we had collaborated with previously, just to make sure that our questions were appropriate for the farming community, to make sure that, we were covering all elements of whether it was stressors or barriers to care that were, relevant for farmers. We wanted to leave no stone unturned, I guess, in trying to make sure that this survey was well suited to doing what we intended to do with this research. After we incorporated feedback from those community partners, we went ahead and connected again with community partners, other researchers in the farmer health and well-being space, and people that we knew with connections in agriculture to distribute this survey widely. So we used a combination of in-person and online recruitment strategies. So in person, we had representatives at the Georgia and National Farm Bureau conferences. We also attended farmers markets. And then as far as the digital recruitment, we created flyers, recruitment materials that we shared with farm-related social media, and again, those community partners to kind of distribute that within the community. We also used a snowball technique where we encouraged farmers who had participated to share the link to the questionnaire with other farmers that they knew, really just trying to cast as wide a net as possible. We collected data from early November of 2022 to the end of February in 2023. And in that time, we had just over 1,000 responses gathered there. After that, we used descriptive statistics, which we'll talk about, to summarize some of those contextual factors and to look at responses to individual questions that we had. And then we used multiple linear regression analyses to explore the relationships between those contextual factors that we've talked about, perceived stress, and alcohol consumption in the farming community. Another element of this data collection that was very important to us was the use of statistically valid scales in the farming community. So much of the research that we had seen prior to collecting this data was not using widely accepted scales that are valid and reliable. So we really wanted to make sure that we used instruments that we knew worked in the assessment of these different barriers to care, and to make sure, excuse me, that these scales were, valid in a new population. We want to make sure that there's not some strange or unique characteristics within the farming population that would require tailoring of these instruments. So to measure perceived stress, we used the perceived stress scale, which I imagine some of y'all are familiar with. It's widely used. It has been used in rural populations before, but very limited application to the farming community. And that assesses stress, or the degree to which a respondent perceives life events to be stressful over the last 30 days. To measure stigma, we used a combination of items from the internalized stigma of mental illness scale and the substance use stigma mechanism scale. Again, we wanted to tap both self and community stigma here. So the ISMI really looks at an individual's feelings related to mental health, how they feel. And then that substance use stigma mechanism scale tapped more of those items about community stigma. So fears about how they would be perceived by other members of their community if they were seen to be engaging in help seeking for either mental health or substance use. In those qualitative interviews that Dr. Proctor described, we heard quite a bit about farmers feeling as though engaging with healthcare resources, particularly those for mental health, were kind of a departure from this cultural norm of resilience. So we wanted to assess resilience as a barrier to healthcare. We used items from both the transcultural community resilience scale and the brief resilience scale here, similar to the application of the ISMI and the SUSMS. This taps both community elements of resilience as well as individual elements. So we wanted to look at how those split and which of those parts were more substantial and at contributing to farmers' perceptions of their own resilience. For formal healthcare challenges, we used a 6-item questionnaire that inquired about those barriers to care I talked to you about earlier, right? So awareness of resources on a local level, financial concerns related to healthcare, whether that's out-of-pocket costs or the cost of insurance itself, and patient-provider relationships, whether or not these farmers felt as though healthcare providers understood what it was to be a farmer and how that impacted those interactions. For alcohol consumption, we used 3 questions from the Alcohol Use Disorder Identification Test. And here we inquired about 3 specific kind of metrics of alcohol consumption. That would be the frequency with which farmers were drinking alcohol over the last 3 months, the amount of alcohol that farmers were drinking at a given time in that 3-month period, and then how often farmers were engaging in binge drinking behavior, again, within that last 3 months. And that would be consuming 4 or more drinks for our female respondents and 5 or more drinks for our male respondents. So again, we really just wanted to make sure that we were using validated scales as opposed to kind of researcher-derived questions to give our findings a little bit more validity.
Mm-hmm. And also, just really briefly, we wanted to make sure that these matched up with some of the themes that we were seeing within the qualitative study. And again, the only one that really sort of diverts is resilience, because the way that our farmers talked about resilience in those qualitative studies is very different than the way that we measure resilience in a scale, which I thought was really interesting. The farmers talk about it more so of like, bootstrapping, being able to handle anything. Whereas when we measure resilience on scales, we're usually looking at, the availability of resources and support, the institutions around those farmers and their trust within those institutions. So that's where the measurement from this survey is a little bit different than what was identified within our qualitative research. Okay, so I'll talk very quickly about the demographics. So again, a majority of our responses were coming from the Southeast and the western part of the United States. And then again, this isn't shocking for us because a lot of the people that were in our network that were sharing the survey are from the Southeast or from the West. So we had more responses because of that convenient sample and snowball sample in those areas in which we had the most contact with people who were helping us share the survey. Also not surprising to us, we have more farm owners and farm managers taking the survey. And again, that goes back to survey distribution methods, where we had many of our people that had worked with us in qualitative research were farm owners or managers. So they were distributing that survey within their own network. So it makes sense that we had a higher response from managers and farm owners. And then also, most of our participants were male. We had about a 68.5% male sample. Again, this is consistent with farmers across the United States. What wasn't consistent was the age. So the average age of farmers within the survey was 33.5 years. And as you all know, the average age of farmers in this country is almost 59 years old, or it's over 59 now, I think. So this is a very, very young sample from the farming population. And that might attribute to some of the rates of alcohol use that you're going to see in a couple of slides. Marital status, most of our farmers were married, and we did have good representation from generational farming, with having primarily second and third generation farmers represented. So when we look at alcohol use of the sample, as you can see, a majority of our respondents, about 96.3%, consumed alcohol within the past 3 months, with 27% of our farmers reporting drinking alcohol 2 to 3 times or 4 or more times a week. And then just over about a third of our respondents were consuming alcohol roughly 2 to 4 times per month. When you look at binge drinking, it was prevalent within this sample. About 23.4% of our respondents reported weekly binge drinking, with about 4% of our respondents reporting daily binge drinking. Again, these numbers are higher than the general population, slightly higher. Really important to keep in mind that, again, farmers are more likely to be in isolated rural areas with lack of access to care. So engaging in heavy drinking and binge drinking is concerning when you look at these numbers of binge drinking in the farming population. Next slide. And again, when we ask farmers about the number of drinks they were consuming in one setting, we were also not shocked by these results based off of our qualitative interviews. You can see here about 34% of our respondents indicated that they consumed 3 to 4 drinks in one setting. with about 19% reporting having 7 or more drinks in one setting. So when farmers were engaging in alcohol use, they typically were engaging in a heavier drinking pattern. And when we conducted qualitative interviews with our farmers, we did hear a lot of, I'll drink a 6-pack at the end of the day to relax, or I'll, go out with my friends and let loose because I don't have many opportunities to do that. So again, it wasn't shocking to us to see these higher numbers consumed in one setting when farmers were engaging in alcohol use.
Sorry. So again, just to return to a discussion of some of those contextual factors that we were interested in here, you'll see our average scores for each of those. We'll start with perceived stress. So perceived stress was high in this sample, which is to be expected considering the various occupational stressors that farmers face. The perceived stress scale divides up, it has different thresholds for levels of stress, with 27 or above indicating high stress. And so we found that to be the case in this sample. As far as stigma, we had moderate levels of stigma in this sample. Again, this may be attributable to that younger generation of less stigma towards mental health than we might have seen if we had an older sample. Those questions that were the most important for stigma, or scored the most highly, I should say, were farmers' concerns that members of their community would take them less seriously if they were seen to be engaging with a resource for either mental health or substance use care. They were also concerned that community members, in addition to taking them less seriously, would treat them differently if they were, if it was publicly known that they were engaging with resources of this kind. There were also concerns about having community members discuss their mental health behind their back, as well as some of those personal feelings of shame. So we do see a little bit more of the community stigma coming through here, but there definitely were elements of self-stigma. Again, farmers feeling as though they may have strayed from kind of this resilient ideal, these values of self-reliance and kind of stoicism that many farmers adhere to. Formal healthcare challenges were prominent in this sample. And again, we saw good alignment between the qualitative interviews that we conducted, as well as the questions that ultimately resonated the most with our respondents. Farmers were concerned not only about the cost of paying out of pocket for specialty care, but also a lack of insurance in general, which is consistent with the broader literature in the farming community, as well as a limited awareness of available resources for specifically substance use or mental health disorders in their community. Resilience was moderate in this sample, and as Dr. Proctor kind of alluded to, the two elements that really impacted resilience the most in this sample were trust in local healthcare institutions and their healthcare providers. So that contributed substantially to farmers endorsing greater resilience, as well as reliance on broader community relationships. So outside of kind of the healthcare infrastructure, and using those kind of informal networks to support themselves and others when there were issues on the farm or within the community. After we explored each of these individual contextual factors, we wanted to look at the relationships between them. So through the use of multiple linear regression, as I stated previously, we identified that both formal healthcare challenges and stigma were identified as predictors of increased perceived stress. So those farmers that were experiencing greater barriers to care or perceived more stigma associated with mental health challenges were more stressed than their counterparts who may have had more ready access to healthcare resources, or were less concerned about the impact of mental health challenges on the way that they would be viewed by members of their community. Consistent with the literature in general, resilience was identified as a protective factor against perceived stress. So farmers that felt they had more resilience were less likely to report high perceived stress scores. And another consistency that we found was that increased levels of stress in our farmers did predict binge drinking behavior. So those farmers that were more stressed than their peers were more likely to engage in binge drinking, or have engaged in binge drinking over the last 3 months. Formal healthcare challenges had an interesting relationship with alcohol. It didn't directly impact binge drinking behavior, but those farmers who reported greater levels of challenges accessing healthcare resources were more likely to drink a higher volume of alcohol. So at any given time, they were drinking more alcohol in one sitting than their peers, as well as drinking more frequently over the last 3 months. So again, not directly related to binge drinking behavior, but higher rates of alcohol consumption and more frequent alcohol consumption were connected to those barriers to care that we surveyed our farmers about. Resilience, again, as with perceived stress, was identified as a protective factor against increased alcohol consumption, which speaks to the quality of resilience at preventing farmers from using maybe these unhealthy coping mechanisms such as alcohol to manage stress and other factors. So when farmers were reported higher resilience, they were less likely to drink high volumes of alcohol in a single instance of drinking.
Okay, finally, I want to share this image from a recent review by Juncker and Radunovich, which highlights the importance of addressing interconnected factors, right, that drive farmer mental health. And the findings of this study really illustrate that there is definitely an interplay between stigma, between healthcare challenges, between poor coping strategies and mental health in the farming population. We have to make sure that we're considering cultural norms and isolation when we're looking at ways to prevent alcohol use and boost mental health and well-being in the farming population. We also have to consider that, there's this vicious cycle that's happening, right? When people don't have access to care and they don't have those resources, they're going to lean on the things that are more culturally accepted and normal within those areas. And so we need to take all of this into account when we're trying to address and develop programs that improve farmer mental health and well-being. And I know we're running up on time, so I'm going to end there, even though I could probably spend, 30 more minutes just talking about this on this slide. Carrie, I'll turn it back over to you.
All right. Thank you, guys. I feel like everything that you were saying, I'm like, you have hit every small rural community that there is. All of those things happen. There's one thing that hit like kind of hard for me. And my family is riddled with alcoholism, and doing research, I remember in college I chose to do my paper on it, and doing the research I didn't realize how many different types of alcoholism there are, and it made so much sense. You hit on binge drinking, and I was like, I remember at the time when I read that I was like, oh my gosh. I'm like, I see so much of this, because they can go days without drinking, but it's like all or nothing. Like there's no middle ground. It's like if I'm drinking and I'm getting hammered, and it's sometimes in the farm machinery, like especially like I hear a lot of it, during harvest or hay season. Their cooler is packed with something else, and you're thinking, my gosh, you guys pay $100, $200, $300,000 for some of this machinery, and it's literally can be a weapon. Things can happen. So you guys feel free to go ahead and unmute if you have any questions for Christina or no. I'm going to check the chat. I don't see anything in the chat. Everyone is saying good job.
Good morning. I don't think my chat came through. If you can hear me, this is Sally.
Yeah, go ahead, Sally.
I'm working on a safety topic for suicide prevention for the month of September. And I found a lot of hotlines for all different groups, youth, LGBTQ, veterans. Is there a specific hotline that's available designated for the ag industry?
We have one. AgriSafe has one. Laura, if you wouldn't mind, if you're available to put that in the chat. So AgriSafe has something called the AgriStress helpline. It's state funded. So right now it is not nationwide, but
Okay.
there is a specific phone number that they will call. 988 operators answer it, but the difference is when they call that specific number, they're going to find a 988 representative that has been trained in our farm response program. And that way they understand the lingo and that the farmer is going to talk about, and the stresses behind farming. Because what we were finding was that when farmers finally do call in somewhere, they spend 30 minutes just explaining why their career choice is stressful, and the person on the other end doesn't quite understand, and they're like, well, this was for nothing, so I'm not calling back. So we'll get that in the chat. I know that there are some other like there are some veteran farm lines and stuff like that, but yeah, all out there, but we'll make sure we get that in the chat for you, Sally. And Christina, know if you have anything to add to that I don't know about, feel free.
That was the first thing that came to my mind. And then I know that some states, again, it's not accessible in certain states because it's state funded, but
Yeah.
from my understanding going, the 988 hotline is the other resource that's available. And that's what we use here in Georgia. Chad
Thank you.
asked for, is there a way to access this data through a published article or other source? Yes. What we just presented on was just published this month in the Journal of Agri-Medicine, and I can share like a PDF, Carrie, with you if you want, because I don't think it's open access. But if you
Okay.
share that PDF with like subscribers, like I will send that directly
Yeah.
to you. Also, what we did was we broke this data down by gender, and we have another article that looked at alcohol use specifically within female farmers, and then also occupational role. And what we found there was that our female farm managers and female farm owners were actually the most likely to engage in daily binge drinking and have higher rates of weekly binge drinking. So we have a paper that also talks about that. So I can send you both of those because I think that would be helpful for the people that were here today.
Yeah, I agree. We're going to send out a email to all the subscribers with like your contact information, everything. So if you get that to me pretty quickly after this, we'll just go ahead and include that in our constant contact email.
Okay, awesome.
Okay, so Jean says, might have missed this, or may this be naive, but I'm interested in the respondents' source of the stress.
Yes. So from our qualitative interviews, we have a very long list of sources of stress from our farmers. In fact, that was the easiest thing to get the farmers to talk about. And we usually led with that in the interviews. And so those include financial stressors, right? So that would include things like medical bills, cost of equipment, overhead cost, market price, having to be competitive with wages, labor shortages was another issue that came up. Also environmental factors were at the top. So, weather, pests, destroying crops, lack of work-life balance was another stressor that was mentioned, right? So again, you can't really escape work when you live in the work. And so there are a lot of farmers that had a hard time disconnecting from work, which was leading to some like sleep problems. And we saw high rates of anxiety reported within those interviews. Noah, what were some of the other top ones?
I think one that really is kind of critical. It also speaks to that provider disconnect that we mentioned. A lot of our farmers described that was a source of stress more broadly, feeling disconnected from even their communities. They felt a sense of camaraderie with other farmers that they lived near or that they spoke to on the phone. But with the increasing development of rural areas, farmers were feeling considerable stress associated with people from urban backgrounds, non-rural kind of people that were not from rural areas, who maybe had no concept of what it was to live near a farm or in a farm community, moving there and then being frustrated that they are spreading manure or driving combines and other equipment on the road. So that was another really prominent source of stress, as well as you know, as Dr. Proctor talked about, with the kind of lack of work-life balance, the strain that that places on familial relationships. So being away from children, being away from spouses and other family members, and really just unable to take a break and kind of escape in a way that would allow them to spend productive time and kind of constructive time with their family members.
Awesome. Okay, Christina and Noah, to stay on time, I'm gonna go ahead and switch over to Chuck, but there are some questions in the chat, if you wouldn't mind, if you have time to go in and answer, and we'll answer those publicly so that everybody can see what the answer is on that. We thank you so much for sharing all of that valuable information. We love to see that. So we're going to move over to Mr. Chuck Strand. And as I mentioned earlier, if you weren't here, Chuck has been here before I think it was like right after, not long after rural mines have been developed. And we want to go ahead and give an update because we love having these organizations back, because when we get you when you're really early, you're in those early phases and things are just getting started. We want to see what you're doing now. And like I said before, like if you're not on his newsletter, get on the newsletter, because there is so much information that comes through. So Chuck, I'll let you go ahead and share your screen and we'll let you go ahead and get started.
Okay, great. Thanks so much, Carrie. Appreciate the opportunity to be back. And thank you also to Christina and Noah for that information. It's really helpful. And of course, alcoholism is part of the problem as far as mental health conditions. And it's a lot of comorbidities and situations that have overlap. But Rural Minds is the only 501c3 national nonprofit that is focused solely on the 46 million people who live in rural communities across the country, and providing those folks with free information and resources to help confront the mental health challenges in rural America, along with the greater stigma that exists in rural communities. So I'll go ahead and share my screen. Just wanted to review the program that we launched just, it's almost been a couple of months ago. Rural Minds is coming up on our 3rd anniversary in October. And I think we launched this late last year, early part of this year. But it's the Rural Mental Health Resilience Program. And here we are at the main webpage for Rural Minds. And under programs, if you click on the Rural Mental Health Resilience Program. So the idea behind this program is recognizing that, as was mentioned, there are many different barriers for mental health in rural communities. The distance to healthcare providers, the lack of internet or non-existent, or either non-existent or spotty, expensive. That could be another problem. But on the lifestyle aspect of the barriers, people not wanting to ask for help is really a problem, because when you're in a rural community, oftentimes you learn to do things yourself. You become very independent, and that independent do-it-yourself mindset is often necessary to survive and thrive in a rural community. But when somebody's considering potentially having an issue with a mental illness or asking for help, along with that mindset of, as it was mentioned earlier, pull yourself up by your bootstraps, it can be a real barrier to reaching out for help. And people in rural communities often want to do it themselves. So what we did in terms of this program, the strategy was to meet people where they're at, and recognizing that we can't create more healthcare providers, we can't speed up the access to internet, but what we can do is to empower people in rural communities to be part of the solution and do it themselves to the extent that it's possible. Recognizing that with severe mental illness, at some point somebody would need to see a mental health therapist. But breaking down that stigma really comes down to talking more about mental health and mental illness. Like with any other problem, unless you talk about it, no one's going to make any progress. So really that was the idea behind this, is to give people what they need and what they want, because we're big on partnerships, and AgriStress is an important partner of ours. We work also very closely with many other organizations, including the National Grange. And the National Grange did a survey about a year ago, and they found that 86% of people in rural communities are somewhat or very interested in more information specific to mental health and for youth mental health in rural communities. So that's really what has driven the development of this program. this stat that you've been looking at here is shocking, and it's the latest from the CDC. People in rural communities are 84 to 86% more likely to die by suicide than people in major urban areas. And that's really important for us to share that, to let people know that there truly is a crisis in rural America for mental health. But we don't want to leave it at that. We want to acknowledge a problem and then give, again, tools and solution, this toolkit of information that can help people be part of the solution to improve mental health in rural communities. So on the left-hand side here, the table of contents lists all the different materials that are part of this program. And by linking to the heading, you can jump down to those sections here. But I'll just sort of scroll down so we can, talk a little bit about this as we're going through it. But this is a work in progress. I mean, as everything is, and we're evolving this, and we're always going to be building on this. The next phase is going to be rural youth mental health peer-to-peer support program, and we're working on that. But we want to hear from people. So if somebody, wants to say something that may not, they might think that they don't want to have their name revealed, or it might not be complimentary, that's fine. We want to, it's not about us. We want to hear what we can do better. So this is an anonymous option for people to give us their comments, or you can just send us an email at info@ruralminds.org, and we can reply to you personally. So the facts about mental health, there's a lot of information here that we've developed these one-page, two-sided PDFs. A lot of times they're two-sided, except for the flyer here, but I'll just go into these for a brief overview. So, all right, the PDF on the program overview. The idea is that people can print out as many as they want to. And if you want to get involved, hand it out to a friend, or better yet, put it on a bulletin board in a local cafe or a place of worship or a local business. And it, again, talks about the fact that there's this emergency, and then what you can do in response, how to be part of that solution. There's a QR code, takes you right to the web page. And of course, we mentioned 988 because that's always a really reliable 24/7 option for people that need help if they're in crisis. A side note about 988, you don't have to be in a mental health crisis to call 988. You can call and just ask questions, whether it's about yourself or somebody else, about mental health, mental illness, how to get people the help that they need. Let's see this. And then the emergency fact sheet. It's like, so why are we saying that there's an emergency? We don't want to, shock and awe is not what we're after, but we do want to, again, make sure that people understand that there's a crisis going on. The lifestyle challenges, we touched on this, but really, all about not wanting to ask for help, and then some of those other, lack of trust and not wanting to be perceived as weak or incompetent. Stigma is huge. So, what can we do to break down the stigma? And really, it's talking about it again, recognizing that we need to start talking about this in order to break down the stigma. September is Suicide Awareness and Prevention Month. So we have a flyer that can be distributed that talks about this. It also links back to some work that we've done previously that's part of this program. And it's the materials that are available. There's two different webinars that were done, and they're recorded on our webinar webpage. And one was the Talk Saves Lives training for rural suicide awareness and prevention. Really valuable information, potentially life-saving, of course. And there's a lot of information and links here to a great, wealth of information specific to rural suicide awareness and prevention. So invite you to check that out too. And as you scroll down, there are fact sheets. So a lot of people, we all hear about, bipolar or schizophrenia. So, the idea of this is to do a quick one-page double-sided fact sheet that really breaks it down in, what is the disorder? How prevalent is it? What are the symptoms? How do you diagnose it? And what do you do to manage the condition? Mm-hmm. And this is then also provides links for more information on whatever mental health condition there is. And we have a similar format to all of these: general anxiety disorder, major depression, postpartum depression, schizophrenia, substance use disorder, and tardive dyskinesia. So a lot of information that can really help educate people in terms of if you think you might be, experiencing a mental health condition or an illness, what are those symptoms? How can you move forward with information to, or start those conversations about mental health. And then talking about, speaking of starting conversations, it's kind of, it'd be awkward to start a conversation with someone that you're concerned about as far as, their mental health or their potential suicidality. So, how do you start the conversation? What questions do you ask? There's no real wrong way to talk about it. It's better to say whatever you're concerned about rather than not saying anything at all. But ideally, it is best to ask a question that is not closed-ended. For example, this being Suicide Awareness Month, it's better to not make it easy for somebody to answer with one word, such as, you're not thinking of suicide, are you? What a better approach might be, how are you feeling? Have you ever thought of harming yourself? And tell me about how, I realize that you're not like yourself normally and recently, and let's talk. But there's a lot of things that can be done that can get those conversations started. And then if people want to take it upon themselves to post social media or whatever it might be, we've got some content for that. And then we realize that not everybody's going to want to lead a community conversation or be the voice of mental health in their community. But for those people who do, we have an event planning roadmap. There is pretty comprehensive. So by no means is it meant that people need to do all of these things. But there are TED Talk types of key messages for leading a conversation. And there's also a PowerPoint slide presentation that can be used for more of a formal presentation. And if you want to promote the event, there are brochures it's all templates that can be customized. Same thing for a media alert if you want to invite the media, press release, a lot of these things. So it's very comprehensive. But again, we want to meet people where they're at. So if people just want to go to the website, learn about it for themselves and become more educated, that's awesome. If people want to start a conversation based on what they're reading and put up a flyer and potentially step up to have a community conversation, that's another option. Wanted to also these resources are included here, but I'm also going to show where they are on the web page, because I think it's important to know where those are too. Let's see, scroll. Okay, going back. So under I Need Help, the crisis resources would of course lead to 988, but there's a compilation of, we're all about partnerships. So people that have organizations that have distributed information and put together these different resources that are all free and online. We want to be able to promote those on behalf of the reason why they were even developed in the first place and get them out to as many people as possible. And then just mental health resources by topic. Really, any one of these, you just click the arrow and you can get all the details, and that's alphabetized by topic. And then we also have just A to Z, everything that you would be out there. And again, we're all about partnerships. We work with NAMI, with Mental Health America, Depression Bipolar Support Alliance. And before we leave the website, I also wanted to mention that there's this amazing, we're going to be doing the rural mental health peer-to-peer support program. And we were very pleased to hit partnered with Pfizer and USA Today. They've done a video that is about rural youth mental health. And it's very well done. I won't take the time to show that now, but please check that out. We also have a webinar coming up on the 25th. And it's about improving access to medicines for people living with mental illness. So please check that out also. So I will, I'll stop sharing and return back. Any questions?
Wonderful, Chuck. I feel like everything that you could ever need, we can find on your website. And it's so well organized that it doesn't feel overwhelming.
That's awesome.
I feel like kudos, fantastic job.
Thank you on behalf of everybody that's worked on it. Huge team effort, so we appreciate that. Thank you.
Yeah, I know, we at AgriSafe love, being able to work with you, like we go hand in hand. Anybody who would like to ask Chuck some questions, go ahead and unmute. I was trying to keep an eye on the chat, for you. I don't see anything very specific here. Lots of resources going on. One thing is, I know that you always have many webinars that people can attend, but you keep those recorded and on your website. Is that correct? So
We do, yeah, they're all archived, and included on the webpage, webinar webpage is the rural suicide awareness and prevention training that I referenced in the brief overview of the materials that are available. But yeah, all the webinars are free. All the resources that we have are free. So it's just kind of like to your point, we want to be access to a lot of helpful, relevant information that's all available at no charge.
awesome. Jake says, here's a stunning figure. Suicide rates among people living in rural areas are 64 to 68% higher than those in large cities.
It's really shocking. Yep. And that was
pretty big number.
The stat before that from the CDC was 25% higher when we first launched Rural Minds. And we were, that was shocking enough. But the fact that it is so high is truly an emergency. Again, we don't want to exaggerate, but people need to understand that it's a huge crisis.
Absolutely. We'll have, once we stop, we'll have you put, I know you did it at the top, but go ahead and put the website in there again, along with your email. Carol says, also worth noting that the use of firearms for suicide is much higher in rural areas. Lethal means safety counseling is important for this community. I think we all.
Exactly. Yes, and that really does overlay with the presentation that we had from Christina and Noah, because oftentimes alcoholism and access to firearms and potentially some mental health condition is all together the behind the potential suicide or an attempt for suicide. So, but that's a really good point as far as just access to lethal means is it's unfortunately more prevalent in rural communities.
Yeah, absolutely. Easy access.
Yes.
I mean, it's just, we have them. We have lethal means everywhere. So,
Yes.
Okay, Miss Natalie raised her hand. Natalie, do you want to unmute? Unless she did that on accident. All right.
Carrie, I'm sorry.
Oh, is that you? Oh,
yes, but
okay,
Natalie's name is on my picture.
Yep.
Don't know how that happened. Thank you, though. I'll put my hand down. I was glad the person brought up in the chat about the use of firearms. I'm going to put in the chat to the link to our CALM training page that we have at AgriSafe. We now have 3 instructors that can do a CALM training, both for communities in the conversations, shorter 1 to 1.5 hour training. And we're also doing trainings for healthcare providers. We just did one of those in East Texas with medical residents. So if you're interested in bringing that training to your area, you can put in a request and we'll get back with you. We do have some funding in some states that allow us to do the CALM training at very little, if no cost. So I just wanted to kind of put that out to our audience today. And I'll put the link to that page in the chat.
That's perfect. So everybody, we will get you an email out within 24 to 48 hours with our speakers' contact information and anything that they want to share with you. I want to take just a second to share my screen and just remind everybody that we have National Farm Safety and Health Week coming up. AgriSafe does this every year in September. And what it is we host Monday through Friday. We are going to have very specific webinars for you to attend. I believe also they will be recorded, but I'll go ahead and put that in the chat because we would love to have you go ahead and join us. Join us on there. But if you just go to agrisafe.org, it's actually on the home page is how I got to this page. We have a little blip right here that will bring you, and then you can actually register right here. So I will stop sharing. And does anybody else have any questions or comments, any promos that you would like to do? Right now is the time.
No, other than Carrie, we're doing a calm training during National Farm Safety and Health Week. So
Oh,
join us.
perfect. Nice.
Mhm.
All right, everybody. I can't believe I'm saying this, but I'll see you in October.
Thank
All
you.
right, everybody have a great week. Thank you.